Among those experiencing homelessness, 31 to 46% report having a chronic medical problem. Research has shown that HIV is 3 to 9 times more prevalent among homeless individuals than among individuals in stable housing situations. Homeless individuals are less likely than the general population to have stable sources of care, and they often rely on emergency departments or ambulatory care settings for their health care needs. Homeless individuals continue to have poor health outcomes, and even with medical services available, they still present with chronic medical conditions. From 2003 to 2012, at least 1,200 Georgia citizens lost their lives due to domestic violence. Nearly 1/3 of American women report being physically or sexually abused by a husband or boyfriend at some point in their life. Over 80% of domestic violence victims struggle with chronic health diseases. Domestic violence contributes to a number of chronic health conditions, including sexually transmitted diseases such as HIV/AIDS. Domestic violence also leads to the development and lack of ability to manage other chronic illnesses, such as diabetes and hypertension. The Mercer University SNAFA chapter would help to provide health information and testing through bi-monthly workshops focused on various topics, including HIV/AIDS, diabetes and nutrition, immunizations, chronic kidney disease, stroke, and stress management. Led by about 5 students, we would engage participants in the shelters by facilitating group discussions, trivia games, and other interactive games such as Jeopardy! Each session would incorporate education, group activities, and point-of-care testing. In the HIV/AIDS session, we plan to provide information about prevention, transmission, testing, and care. Infection rates are high in Atlanta, with Georgia being ranked 8th in the number of people living with AIDS in 2005, according to the Community Foundation of Atlanta. Both Fulton and DeKalb counties near Mercer University have the highest infection rates in Metro Atlanta. In providing access to HIV testing for homeless people and domestic abuse victims, we can help to educate people and prevent the further spread of this disease in our community. During the diabetes session, we will discuss food and nutrition, causes of diabetes, and treatment. We will also incorporate glucose testing and help with the interpretation of results, letting people in the shelters know if their readings are normal and whether to follow up with other healthcare providers. In order to facilitate group involvement, we would discuss eating habits and diabetic-appropriate foods and recipes, particularly those that are more affordable for individuals and families. We also intend to provide information about important vaccinations for adults and children. With the money from the Prescription for Service competition, we would also be able to provide immunizations, such as hepatitis and influenza. In our session about chronic kidney disease, stroke, and stress management, we would use a portion of the grant money to facilitate blood pressure screenings, explaining to participants what normal readings are and where to follow up with another healthcare provider. Those who are homeless or victims of domestic abuse situations are certainly in high-stress situations, sources for stress management as well. In addition to offering information and clinical services, we would also like to facilitate a book drive for the children of the people in the shelters we work with. Though this tangible service is not directly related to pharmacy, we want to foster the idea of giving back to the community in a multitude of ways as future professionals.